What does villous atrophy mean for gluten-free diagnosis? Have you ever wondered how doctors determine if someone has celiac disease? One important factor in this diagnosis is something called villous atrophy. So, what does villous atrophy mean for gluten-free diagnosis? Let's break it down in simple terms. Villous atrophy happens when the tiny finger-like projections in the small intestine, known as villi, become damaged and flattened. These villi play a vital role in absorbing nutrients from the food we eat. When they are damaged, the surface area for absorption decreases. This can lead to malnutrition and symptoms like diarrhea, weight loss, and fatigue. In the context of gluten-free diagnosis, villous atrophy is often identified through a procedure called an endoscopic biopsy. During this procedure, a small tissue sample is taken from the small intestine and examined under a microscope. If villous atrophy is present, it supports a diagnosis of celiac disease, especially when paired with positive blood tests for specific antibodies that indicate an immune reaction to gluten. Once a person diagnosed with celiac disease starts a gluten-free diet, the villi usually begin to heal, and symptoms often improve. However, some individuals may experience persistent villous atrophy, meaning the villi remains damaged even after following a gluten-free diet. This situation can indicate ongoing gluten exposure, a slow recovery of the intestine, or, in rare cases, complications like refractory celiac disease or other intestinal conditions. Persistent villous atrophy is concerning because it can lead to long-term complications. It may require closer medical monitoring and further evaluation to ensure that the gluten-free diet is effective. For those navigating gluten-free living, understanding villous atrophy is essential. It confirms that gluten has caused damage to the intestine, making it necessary to stick to a strict gluten-free diet. It also explains why some individuals may not feel completely better until their intestinal lining has had time to heal, which can take months or even years. Regular communication with healthcare providers is key. Adhering to the gluten-free diet and sometimes undergoing repeat testing are important steps in managing health and well-being for those diagnosed through villous atrophy findings. Understanding this condition helps individuals make informed choices about their diet and health management.